The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Magandang gabi po sa inyong lahat. Good evening. Naimbag arabii, maayong gabi sa inyong tanang. I'm yours truly, Dr. Marife Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Here we are again on Healthy Mondays, and thank you so much for tuning in. Maraming salamat po sa inyong pakikinig sa aming programa. So tonight is a night where we can talk about something that might be happening with you or your loved ones, and Breast Cancer Awareness Month. So October is Breast Cancer Awareness Month. It's an annual campaign to raise awareness about the impact of breast cancer. So, what is breast cancer? A cancer that develops in the breast cells and progresses in stages. Few early symptoms may include new lump in the underarm or in breast, itching or discharge from the nipples, and skin texture change of the nipple or breast. It is very common in the United States. We have more than 200,000 cases per year. And it could be maybe attributed to advanced technology. And it often requires lab tests or imaging. And in the cellular level, cancer develops in the tissue of breast, affecting both men and women. We always think that breast cancer can only happen in women, but it can happen in men because men has breast also. And in the cellular level, cancer develops in the tissues of breast, and with different reasons like family, history, or changes in the genes, and it progressed through stages. The symptoms would be the presence of a lump in the breast and change in the appearance of the breast. Treatments is primarily based on the type and stage of cancer. And we will go over the symptoms, specific symptoms, the treatments, as well as the causes. And before we do that, let me start with some questions and answers found in the National Breast Cancer Foundation website. So listen up. Here you go. I'm going to take a quiz. I'm going to give you a quiz after this. So the first question is, a lot of people ask about, is dairy, for example, milk, can it be linked to a higher risk for breast cancer? Well, study shows, and based on the National Breast Cancer Foundation website, the U.S. dietary guidelines recommend women consume 3 cups of dairy daily. Note, cups of dairy include foods containing dairy. The dairy group includes calcium-fortified soy milk, along with milk, cheese, cottage cheese, and yogurt. So the current nutrition guidelines for dairy milk consumption could be viewed with some caution. There is limited evidence suggesting that higher intakes of dairy milk were associated with greater risk of breast cancer. Nevertheless, drinking milk is good because it could also help you with your bone density, and also can help you with other things. Having milk also can strengthen your bones, right? So the recent study in 2020 suggests drinking dairy milk increases the risk of breast cancer. The link was clearest with milk calorie intake, with a 50% increased risk of women among the top 10% of milk drinkers compared to those among the bottom 10%. Risk was similar for both full fat, so it depends on the type of milk that you will consume. So both full fat and low fat versions, and premenopausal and postmenopausal cases. However, experts also say to consider the research previous to this study in 2020 before skipping out completely on milk or dairy products. And previous to this study, the American Institute for Cancer Research found no evidence linking dairy or dairy milk to breast cancer risk. It's kind of confusing, But basically, dairy is a good source of calcium, which is important for building bones and teeth, along with helping to maintain bone density, as I have mentioned earlier. Dairy foods also contain essential vitamins and minerals, such as potassium and phosphorus. Nearly all milk is fortified with vitamin D, which helps promote absorption of calcium. If you are unable to consume dairy or do not want to, other foods that contain calcium includes greens like collards, broccoli, kale, bok choy, that's my favorite. Edamame is also my favorite. Soybeans, tofu, dried figs, fortified drinks such as orange juice, nuts, seeds such as almonds, and sesame seeds, and calcium fortified cereals. Okay, are you ready for the second question? Here you go. The second question is hair dye linked to a higher risk of breast cancer? Oh my, look at my hair. I have dye on my hair. So let's see what the expert and researchers say about hair dye. So researchers have been studying the possible link between hair dye and cancer for a long time. But results have been inconsistent, like anything else that still needs long-term study. A recent study, though, published by the National Institute of Health in 2019, suggests that breast cancer risk increased with more frequent use of these chemical hair products. This study found that women who use permanent hair dye and chemical hair straighteners have a higher risk of developing breast cancer than women who don't use these products. Particularly, this study found that women who use hair straighteners at least every 5 to 8 weeks were about 30% more likely to develop breast cancer. While the association between straightener use and breast cancer was similar in African American and white women, straighteners use was much more common among African American women. So, keep note of that. It is important to note also we are exposed to many things that could potentially contribute to breast cancer, and it is unlikely that any single factor explains a woman's risk. However, avoiding these chemicals might be one more thing women can do to reduce their risk of breast cancer. And the sources for this can be found in our website, www.cancer.org/cancer/causes/hair dyes. So you can also look for more information about hair dye linking to breast cancer. Okay, here's another question, which has a short answer. Ready? Okay, can breast cancer reduce the risk of, no, scratch. Can breastfeeding reduce the risk of breast cancer? Breastfeeding can reduce the risk of developing breast cancer. And there's still not much study about the linkage of the breastfeeding if it is actually reducing the risk of developing breast cancer. But on the surface, breastfeeding can reduce the risk of breast cancer. Okay, another question. Can physical activity reduce the risk of breast cancer? I think you already know the answer to this. Back to basics. Exercise boosts the immune system, and it helps you to keep your weight in check. With as little as 3 hours of exercise per week, or about 30 minutes a day, a woman can begin to lower her risk of breast cancer. But this doesn't require going to a gym either. I don't go to the gym, but I do walk around my neighborhood. If I have a chance and I have time, I ride my bike. Power walking is also sufficient. It is more than sufficient. So you don't have to go to the gym for this physical activity. Okay, let me see. I think I still have at least 2 questions. The next question is, can a healthy diet help to prevent breast cancer? And I think you already know the answer to this. A nutritious, low-fat diet, about 30 grams or less, with plenty of fruits and green and orange vegetables, can help reduce the risk of developing breast cancer. A high-fat diet increases the risk because fat triggers estrogen production, and that can fuel tumor growth. Okay, let's just sink into the answer for that. I think you get it by now. Back to the basics with healthy diet and exercise can help you prevent and reduce the risk of having breast cancer. Here's another one. I think it's our last question. Does smoking cause breast cancer? Smoking is a confirmed risk factor for many types of cancer, not only breast cancer, lung cancer specifically. Recent research study in the last year confirmed that smoking is a contributing risk factor for developing breast cancer. And additionally, secondhand smoking. So it doesn't mean that if you don't smoke that you are not at risk for smoking, but if the people around you are smoking, you are also at high risk for developing breast cancer. So if you are a smoker, help yourself in a significant way and join a smoking cessation program to help you stop. The day you stop smoking, the healing can begin, and each week in which you are smoke-free, you give yourself increasing advantages for a healthy life, healthier life. Smoking also directly contributes to heart and other lung diseases, as I mentioned before. Okay, those are your Q&A for this increasing awareness for breast cancer. Now we go right into some information about breast cancer itself. The symptoms, I think this is going to help you with early detection of breast cancer. Symptoms, in many cases, symptoms may go unnoticed until it becomes severe, and it may include, again, as I mentioned earlier, a lump or mass in the breast that feels different from the surrounding tissue. Also, change in the shape, size, or appearance of the breast is also a symptom. So it's very important to do monthly breast check, self-breast check. Also, discharge from the nipple, that is not normal. That is a symptom of breast cancer. Also, rashes in your breast is also a symptom. Again, changes in the skin over the breast, for example, dimpling, that is a serious sign of breast cancer. And if you're having pain in your breast, it's also a symptom. Sometimes some people have inverted or pulling in of the nipple. That's a symptom that something is happening in the structure of your breast. Scaling, peeling, or flaking skin over the breast, particularly the dark area around the nipple, is also a symptom. And lastly, redness and or pitting of the breast skin, resembling the skin of orange. The breast is supposed to be, if depending on your skin color, brown, light skin. But if there is some tinge of orange, please see your doctor right away, because that is one of the symptoms of breast cancer. Now, if you were told that you have breast cancer, early stages or end stage, there are treatments. Breast cancer is treatable. Treatment is primarily depending on the type and the stage of your cancer. Usually, you go into being treated with medications to stop the growth of the cancer itself. Chemotherapy is one that is used. These are drugs that are recommended before or after surgery, and mainly this is to reduce the mass or size and the spread of the cancer and even recurrence of the cancer. Some of the medications are capecitabine, carboplatin, doxorubicin, and vinorelbine. This information you can find it in the American Cancer Society website, and I'm going to give you the website before the end of the show. Hormone therapy is also another medications that could be given in treatment of breast cancer. These drugs are used in hormone therapy that help regulate proliferation of hormone-sensitive cancer cells and prevent the production of hormones or reduce their action. Basically, in lay terms, it just disturbs the production and the binding of the cancer cells and with the healthy cells. And also, some of the treatment could be procedures itself, such as lumpectomy, and that is just a removal of the lump on your breast. Mastectomy is the removal of the breast itself, and sometimes they will do partial mastectomy, which means part of the breast, or they remove both breasts to just prevent it from spreading from one breast to another. And then after the medical procedures of the breast removal, then the breast reconstruction can be done. Another therapy or treatment could be radiation therapy. So it would be used in conjunction with your chemotherapy to reduce the size of the cancer itself. And also radiation therapy is used to reduce the size and also to prevent it from spreading to the rest of the body. You're probably wondering, what are the causes of breast cancer? I wanted to know what causes so I can prevent it from happening to me or from my loved ones. So the exact cause is unknown, but you can also look at the risk factors. And some of the risk factors you cannot do anything about. For example, family history. When you have a family history of breast cancer, then you're high risk for having breast cancer. Another cause is age. You are at more risk of breast cancer after 40 years of age. And so you may be wondering why your doctor is recommending for you to have mammograms and monthly self-breast exam is because as you grow older, you become high risk for the breast cancer. Did I mention hormonal changes? I'm menopausal, the hormonal changes that happens to our body also when we are having our period, right? That time of the month. Another cause or risk factor for breast cancer is your lifestyle, including excess of alcohol consumption. Environmental factors also, including exposure to radiations. That's why if you're a healthcare worker, or you are your employment or your work is related to being exposed to radiation, then you have to be really careful. Obesity and being overweight is also a risk factor. Menarche. So do you know what menarche is? Having periods at a younger age and menopause at an older age is a risk factor. I wasn't sure of this, but now it's here in the literature that having periods at younger age and menopause at an older age is a risk factor for breast cancer. Pregnancy. Becoming pregnant at an older age or never being pregnant is a risk factor for breast cancer. And lastly, hormone use, including long-term contraceptive use or postmenopausal hormone therapy. I remember when I was in the early stage of my menopausal, my doctor was going to give me some hormone therapy or postmenopausal hormone therapy. And when I told them that I have family history of breast cancer, we're 5 girls in my family, and my 4 other sisters had been diagnosed with breast cancer, so that put me at a higher risk of having breast cancer. So I just had my mammogram and also my ultrasound taken, so every year I have to take that. So those are the very important information that I wanted to share with you, to our listeners out there, about breast cancer in celebration of the Breast Cancer Awareness Month, which is October. Now I'm going to share with you, I looked up about any local events that you can participate in supporting Breast Cancer Awareness Month. I think this is in coming up October 24th. It's called 2021 Making Strides of Las Vegas, Nevada is happening on Sunday, October 24th at the Red Rock Casino Resort and Spa. Registration is at 7 a.m. and the walk starts at 8:30 a.m. You can follow the event on Facebook and Twitter. There's also another event that's related to Breast Cancer Awareness Month. This is happening on November 13 in 2021 at Silverton Casino from 10 a.m. to 2 p.m. This is called I'm excited to share this with you. It's called Construction versus Cancer Las Vegas. It's a very unique fundraising event that provides a festive and a carnival-like atmosphere amongst construction equipment that benefits the American Cancer Society in their mission to eliminate cancer as a major health issue through research, patient services, and advocacy. And talking about patient services and advocacy, the American Cancer Society have cancer information and questions about specific cancers, treatment options, side effects, coping with cancer, medicines, pain control. There's also some clinical trials that you and your loved ones can participate in if you are interested. There's also information about prevention, screening, and how to quit tobacco use. The toll-free number for American Cancer Society is 1-800-227-2345. And the local resources included for referrals to patient services, support groups, social services, medical equipment, wigs and prosthesis, transportation, lodging, financial programs, and the quit line. There are also day-to-day help and support, such as rides to treatment, and sometimes getting to your cancer treatment is a challenge. Lodging also if your cancer treatment is far from home and you need a place to stay. American Cancer Society can also help you with that. With the chemotherapy that is expected, the hair loss, and there's also information about mastectomy products. Some women use wigs, hats, breast forms, and bras to help cope with the effects of the treatment. It is called the Tender Loving Care Catalogs. Breast cancer support. Women with breast cancer can talk with a trained Reach to Recovery volunteer who is a breast cancer survivor. There's also online community. You can share experiences, practical tips, and hope through American Cancer Society Survivors Network. Wow, there is a lot of information, and I can go on and on and on to give you information about breast cancer. You can help reduce your risk of cancer by making healthy choices like eating right, staying active, and not smoking. It's also important to follow recommended screening guidelines, which can help detect certain cancers early. And there you have it, our listeners out there. Asian American Pacific Islander Nurse Association of Nevada is very happy to share you with this information to keep you healthy. And so having said that, will join me again next Monday. Remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.